So my name's Bill Bush. I'm an associate professor of history at Texas A&M San Antonio. I've written a book entitled Circuit Riders for Mental Health, the Hogg Foundation in 20th Century Texas, with support from a grant from the Hogg Foundation. And the book tells the story of the Hogg Foundation's history and the history of mental health in 20th century Texas. So Miss Ima was one of four children, born to James Stephen Hogg and Sally Stinson Hogg in the 1880s. And she came of age at a time when her father was becoming an important person politically in Texas. He was the Attorney General of Texas in the late 1880s, and then he was elected governor of Texas in 1890, and he served in the first half of the 1890s in the governor's mansion. This was during Ima's childhood, so Ima came of age in the center of Texas political life, in the center of the progressive reform movement in Texas, which her dad, James, was really at the head of for those years. And it was during that time that she became acquainted with people with mental illness. So she toured some of the asylums, as they were known at the time, with her father in the state of Texas, including the Austin State School and the Austin State Hospital. That piqued her interest in mental hygiene. Later, she began to experience personal tragedies in her life, the passing of her mother, and then later the passing of her father and two of her brothers. She experienced bouts of depression during those times that led her eventually into direct contact with the mental hygiene movement. Mental hygiene is the term that immediately precedes mental health. And so in the early 20th century, mental hygiene would have been the terminology people would have used in place of what we say is mental health today. Really what mental hygiene tends to refer to is the treatment of people with emotional disorders outside of institutions. So it's really a profoundly anti-institutional movement. It's a movement that believes that most of the people who were being held in mental hospitals or asylums really didn't need to be there, that they really could have been in the community, they're in their homes with their families, receiving some kind of regular treatment or having other types of interventions developed for them to allow them to function, right? And that's really that idea of being able to function in sort of, quote, normal society is mental hygiene. So Miss Ima comes back to Texas determined to try to bring mental hygiene to the state of Texas and to try to offer community-based treatment options that didn't exist in the state at the time. My sense of Miss Ima is that she was a very forceful personality, but not necessarily in a kind of a loud, extroverted way. That she was somebody who maintained sort of appropriate manners for a woman of her station, but nevertheless was very tough-minded and would not be pushed around if there was something that she thought needed to be done. And her history is replete with instances where she exerted her will to make something happen that she thought needed to happen. She was somebody who was very compassionate, somebody who was very empathetic to the needs of others, and was very creative in finding ways to bring activities into the orbit of mental health that you might not think of as mental health. So, for example, in the 19-teens, she becomes very involved in founding the Houston Symphony, and is very involved in the arts as part of her philanthropy. And she saw that very much as of a piece with mental health, right? Anything that helps somebody to her was mental health. And if that meant working in the arts, if that meant creating music, if that meant taking children to the symphony, that was also mental health. So the Hogg Foundation itself was really something that was about a decade in the making. I mean, arguably it was much more than that, but it really begins with the passing of Will C. Hogg in the fall of 1930 in Germany. And then the decision of what to do with his will, which was about $2.5 million, a lot of money in 1930. And in his will, he had left three separate options for what could be done with his estate. Miss Ima and her brother are left in charge of the estate, and after a series of extensive negotiations with the Board of Regents, it's agreed upon to start a foundation for mental health. So in 1940, the Board of Regents and Miss Ima and the president of UT Austin, Homer Rainey, organized a symposium, a two-day symposium with a series of national experts who came in to discuss the new foundation, what its work would be for the foreseeable future. And they brought in some of the most renowned psychiatrists and psychologists and academicians in the country to have this discussion. They also brought in a lot of people from the community, prominent individuals. So there was a lot of buzz, kind of a lot of excitement about this new foundation. A lot of people were excited about it. The question that needed to be answered in 1941, in 1940, was who is going to be the first leader of this new foundation? It's a really important question. The recommendations that the advisory committee that they had brought in had given them were all for people who worked in the fields of psychiatry and psychology, prominent individuals who directed mental health centers or clinics in other parts of the country. Rainey kind of went for an outside-the-box choice, and he recommended to Miss Ima, a former student or former faculty member of his, a colleague of his from Bucknell University named Robert Sutherland. This was somebody who Rainey had been associated with for about 10 years. Rainey had been his department chair in sociology at Bucknell University. Sutherland was a sociologist by training, so he came from a discipline that was not as directly involved in mental hygiene as psychology or psychiatry. But he thought that Sutherland had the right set of skills that were needed to get the foundation off to a solid start. And so Miss Ima met Sutherland. They hit it off right away. Sutherland interviewed with the Board of Regents, and he ends up becoming the first director. And he and Miss Ima will go on to have a very close partnership for 30 years, and obviously a very successful partnership. Circuit riding, of course, traditionally what circuit riding describes is the activities of a minister or a preacher who didn't have a congregation, a home congregation. So an itinerant minister who traveled a circuit, maybe visited several different locations, delivering sermons, ministering to the needs of a group of people, and that was called riding circuit. So when Sutherland and his group apply it to what they're doing, what they're describing is that they were driving all over the state, and they hit all 254 counties eventually in the 10-year period after the foundation began, delivering talks, consultation to, town leaders, schools, especially a lot of schools. They visited churches, talking about mental health. And in many cases, introducing people for the first time to the concept of mental health, because a lot of people, especially in rural areas, had never heard of it before. They crisscrossed the state over and over again. So Sutherland and his small number of colleagues regularly drove all over the state. Sutherland himself gave, between 400 and 500 talks in the first 3 or 4 years he was the director, which is an extraordinary number of talks to give. He leveraged his extensive national network of experts to bring in some pretty renowned figures to give talks to different groups of people, to military bases, to the staff at the state's mental hospitals. And eventually they came to view themselves as circuit riders. And of course, what that also reflects is this sort of sense of religious mission that they brought to the job, that they were helping to improve society. They were helping to, in some ways, bring modernity to areas that still were quite backward in a lot of ways. The other thing that's really interesting about Sutherland's a couple of things. One is his PhD is actually listed as being in Christian theology and ethics. So if you think about him then later going on to coin the phrase circuit riders for mental health, it makes a lot of sense. He brought a religious sense of mission to the job that a more conventional choice might not have done. Right? A more conventional psychiatrist or psychologist might have gotten more involved in the academy, might have been more focused on research, basic research at the outset. Sutherland was much more focused on the community. He was much more focused on raising the public's consciousness about mental health. And that's essentially what the foundation is going to do for the first 10 years, and it's going to pay off in a lot of very positive ways. A lot of the political and policy reforms that take place are going to take place because Sutherland and the foundation are going to create a demand for it by raising the public's awareness about the issues surrounding mental health. So Sutherland, when he arrives as the first director of the Hogg Foundation, he has a mandate to work explicitly outside of institutions. And really the impetus of the foundation is to work on mental health in the community, to educate the public about mental health, to work on services in schools and churches and to help families. It's decidedly a non-institutional approach. However, they are not able to pretend the institutions don't exist and that the problems associated with those institutions don't exist. Very early on in his time with the foundation, Sutherland is essentially confronted with the problem of the institutions. He begins corresponding with the head of a state agency called the Texas Board of Control, a state agency that had been founded in 1920 and that was given a really broad scope of responsibility to administer all of the state's institutions for dependent populations. So that included all the juvenile delinquents, orphans, people with mental illness, senior citizens, a whole range of different populations, right? It's a 3-member board, and they're all judges, and they're all based in Austin, and now they have responsibility over this archipelago of far-flung institutions about which they have very little expertise. So Sutherland starts corresponding with Weaver Baker, who was the head of the 3-person Texas Board of Control. And through that correspondence, and they meet, they're both in Austin, so they meet, and they actually become pretty good friends. The Hogg Foundation begins providing in-service trainings. They start publishing a newsletter just for the staff. They start bringing experts in to evaluate what they're doing and to do sort of demonstration programs. So, for example, he brings a chaplain in who's been trained in counseling and mental health to talk about the importance of religious services in the institutions. They bring in an art and music program at the Austin State School. So they start, enrichment, really. They start providing enrichment to the programs. But of course, you can't ignore the fact that these institutions have a lot of problems. The Public Health Service, the U.S. agency that oversaw all of the federal mental hospitals, published 2 lengthy surveys of the Texas mental hospitals and just, tore them apart, said they were really in bad shape. By the late 1940s, you have really an emerging movement to do something about it. What's going to ensue in the 1950s is that the Hogg Foundation and the Texas Society for Mental Hygiene, the Texas JCs, a bunch of other civic organizations, they're going to mount a public campaign. This is when the Hogg Foundation is going to sponsor a documentary film called In a Strange Land that's going to describe conditions in the Texas state hospitals and advocate for reforms. They're going to bring William Menninger to the state, and he's going to give an address to a joint session of the Texas legislature that's going to be met with a standing ovation, urging them to approve a new mental health code and to increase funding for the mental hospitals. And the title of his talk is going to be Brains Before Bricks. He's not asking for increased funding to build more facilities. He's asking for increased funding to bring more experts in to work with people with mental illness and to provide better services. So the Cold War is an interesting period for mental health. The Cold War, the domestic Cold War, that is the Cold War in the United States, really probably peaks in intensity in the first half of the 1950s, right, with the McCarthy era, right? McCarthy comes to the kind of the national consciousness around February of 1950, and he flames out by the fall of 1954. But that period in between is really a pretty tense time when there are a lot of people who are losing their careers or even being put in jail or leaving the country over being accused of some kind of subversion, right? That's really going to have a ripple effect for many more years afterwards. And for mental health, what's going to happen is that field is going to start to get associated with subversion, mostly by a new sort of fringe political movement on the political right that inhabits sort of newsletters, talk radio, and organizations like the John Birch Society. And they're going to associate mental health with brainwashing, the idea that what they're really trying to do is control people's minds. And of course, we know this is kind of memorialized in pop culture in the film The Manchurian Candidate in the early 1960s. But there were articles written about brainwashing as a real problem in the 50s. And some people are going to associate mental health with that. There's a whole series of sort of very colorful, fringy characters who bring this to light nationally in the 1950s. How does this touch on the Hogg Foundation? Let me add one other thing about this. The other thing that causes mental health to be associated with this is that the academic disciplines that are most closely associated with mental health, psychology, psychiatry, sociology, they are also closely associated with school desegregation, right? So for people, especially in the South, who see school desegregation as a communist plot to weaken the United States, right? That is another way in which mental health is going to get tarred with this sort of subversive brush. The Hogg Foundation will start to be affected by this in the late 1950s. And one specific incident that stands out was a survey of high school kids that the foundation was conducting in the late 1950s as part of a book-length study that was part of the Research Monograph series. The book's eventually going to be published in 1965 as Tomorrow's Parents, co-authored by Wayne Holtzman and Bernice Milburn Moore. And it was based on extensive survey data of something like 13,000 high school kids in the state of Texas. So in 1959, they were attempting to do a survey of high school kids in Houston. Houston was one of the kind of the hotbeds of this radical right social movement in Texas at that time. And in Houston, the school board was the site of struggle between sort of more maybe liberal members and a sort of hard right group called the Minute Women, some of whom had been elected to the Houston School Board, and that were fighting desegregation and other things, sort of tooth and nail. Guidance counseling, which was something that was being introduced in some of the public schools, was another thing that was causing mental health to be associated with subversion, right? What are guidance counselors really doing, right? They're sort of brainwashing our kids. So the Hogg Foundation researchers, they have a team of researchers. They're conducting surveys in high schools all around the state. In Houston, which was a kind of a hotbed of this far-right movement, they attempt to conduct surveys of high school kids. And a group of these sort of opponents of mental health whip up concern about this. They feel it's intrusive, it's an invasion of privacy to ask these questions. And what ends up happening is that the researchers burn the survey results publicly in front of the media, in front of a sort of a rabid crowd that was complaining about it. This is very disturbing for a lot of reasons, not just the symbolism of book burning, but of course seems to symbolize the anti-intellectual danger that is posed by the sort of the Red Scare, sort of a threat to academic freedom, but also kind of crystallizes some of these anxieties about mental health in some weird and theatrical ways. So the UT Tower shooting, of course, took place on August 1st, 1966. The Hogg Foundation's offices were in the UT Tower on the 24th floor, so it only happened a few stories above the Hogg Foundation offices. The shooter, Charles Whitman, was a former Marine. As would later be discovered, he had visited the UT Student Health Clinic only a couple of weeks before the Tower shooting and had met with a psychiatrist named Maurice Heatley. Heatley had not really noticed anything that could have indicated he would do something like what he ended up doing. The problem that was related to mental health here was that student counseling services were fairly non-existent at the time. And most universities in the country did not really have anywhere close to the student counseling services that we now take for granted at colleges and universities today. The person who took the lead on this for the foundation was Ira Isco, who of course would train a generation of community psychologists in the 1960s and 70s. And he was an alum of UCLA, which did have one of the first student counseling services in the country. And he went to UCLA in the wake of the Whitman shooting and studied what they did and spent some time there and came back and led in the development of a more robust student counseling services that included a 24/7 hotline for people to be able to call if they were in distress. And that hotline would be staffed with people who, not necessarily people who had academic training, but who were good listeners. He created off-site services as well outside of the campus. They experimented with a coffee shop, using a coffee shop as a place to meet with people who were experiencing distress. They called it the listening ear. They became really a path breaker. When I interviewed him, Isco claimed to me that the suicide rate at UT Austin became one of the lowest in the country over the next 20 years as a result of the more robust student counseling services that were developed in the wake of the Whitman shooting. So there's an interesting confluence of events that happens in the first half of the 1970s. So in 1970, Robert Sutherland retires, and Wayne Holtzman succeeds him as the second director of the foundation. Within 6 years, both Sutherland and Miss Ima will have passed away, and those are really your two founding figures for the foundation. This coincides with a really dramatically changed landscape for mental health by the early 1970s. So when the Hogg Foundation started, the entire landscape of mental health was the hospitals. That was it, right? There were almost no clinical services available in communities. You didn't have counseling services in schools or in college campuses. The language of mental health was not part of people's everyday lives. Industrial mental health didn't exist, right? So in the workplace, also not really a consideration. By 1970, you have the Texas Department of Mental Health and Mental Retardation. You have dramatically increased funding. You have a deinstitutionalization movement that's well underway, of people being moved out of institutions. You have a population that's much more conversant with mental health and mental illness. It's not as much of a stigma to be diagnosed with a disorder or to be willing to self-report that you're having a problem. As a result, the foundation, to some extent, had succeeded, right, in a lot of its major goals by the early 1970s. And what were the sort of the new horizons to be conquered, right? I mean, it's not clear. And there is a period in the 70s of kind of soul searching, what do we do now, right? And the evaluation research program is going to become a major component, and basically it's going to allow for innovation. They're going to fund a lot of nonprofits, a lot of pilot programs in MHMR and studies by academics. They're also going to focus extensively on bringing mental health services to populations that historically have been excluded from those services. So African Americans, Mexican Americans, working class populations that didn't always have easy access to mental health services. So there's going to be a big focus on that for the foundation. Unfortunately, there's going to be another pendulum swing by the early 1980s that's going to really handicap a lot of what the foundation is able to do, and that's going to be that at the national level there's going to be a turn politically to the right and a massive cutting of funds at the federal level for mental health services. So right at the moment that people are being released from institutions, the funds for community-based services are going to start to dry up. And that's why you're going to end up with homeless folks in the 80s and 90s, with people with mental illness being homeless, partly because of that kind of convergence of factors. This is really going to be a challenging time for the leadership at the foundation. First Wayne Holtzman, and then briefly Charles Bonjean, and then King Davis, to kind of reimagine what the foundation is going to do. And of course, that's a reimagining that's happening right now, as I think the foundation has become reconnected with public policy reform in some interesting ways, and has continued, and I think enriched dramatically, the involvement of historically excluded populations from mental health services. And of course, the consumer movement of the last 10 to 15 years has dramatically changed the way that we talk about mental illness. We don't use the same language to talk about mental health and mental illness today. So there have been a lot of dramatic changes.